Hi, my name is Emily Hamilwright, and this is my case study 3. So just a reminder for client information, I'm working with a female who is 4 years old. They have a diagnosis of ASD and no other previously diagnosed medical conditions. The services that they receive include OT, ST, and ABA. And their communication mode includes speech device, vocal sounds, but minimal functional speech output. Behavioral target of focus is elopement, and elopement is any instance or attempt in which the patient moves more than 5 feet away from an adult without express permission to do so. Non-examples include playing outside or when an adult explicitly gives permission. Behavioral intervention overview for elopement. So just to recap from last time, the hypothesized function was access. Antecedent strategies include verbal prompt before transitioning, environmental modifications, and providing choices prior to placing demands or transitions. Behavioral techniques used include functional communication training with least to most prompting, differential reinforcement of alternative behavior, or DRA, and then consequence strategies include blocking or redirecting, error correction, and functional communication training. So, to train staff on the behavioral intervention plan methodology, we will be using the Behavioral Skills Training, or BST model, which is a 4-step training process, which the first step includes instructions. We will be explaining the target behavior, the antecedents, replacement behaviors, and consequence strategies. So providing both formal training and a meeting to update on the behavioral of target and review any of the new intervention goals, as well as having a clear written description of the behaviors, as well as all of those components that can be understood by the staff implementing or taking data on these behaviors. Modeling is the next step, which goes to model the intervention with the RBT. So first you can model during training or a meeting when you are updating on the intervention, and you want to model with the RBT and then transition to model with the patient and NET whenever that behavior occurs or whenever that target needs to be run, so that you can train them in vivo and run through it. And then rehearsal includes the RBT practicing the intervention with the client when the BCBA providing feedback and instruction is needed. So throughout, the BCBA can also collect data on the integrity of the treatment protocols being ran as in the intervention implementation. Rehearsal can just be the day-to-day implementation of the intervention and be assessed during supervision. And then feedback, BCBA will provide the RBT feedback on their performance, use notes on integrity to review their implementation, and provide both positive and constructive feedback to the RBT. So this can be, again, during meetings or obviously during supervision, giving that corrective and that positive feedback as it occurs. And then continued staff behavioral intervention plan implementation support plan. We'll be using some functional-based strategies, including supporting identification of strategies to improve staff performance, using procedural integrity checklist, IOA data, and interview format assessments. So during supervision time, there will be the direct sessions with patients where you can collect IOA and provide feedback in real time, which you can also assess where any barriers are, where more training is needed, more clarification may be needed, maybe updating your behavioral definitions to be more clear and concise so that that measurement can be recorded accurately. and procedural integrity checklist, which would be having that task checklist or the run through of the intervention and ensuring that you can check off on that. And there's at least that 80% IOA, and then procedural integrity, you want to have them pretty much 100% accurate on running through procedurals and provide extra training and feedback as needed, as well as check-ins with staff, which would be the interview format assessment, where you can check in group or individual format on maybe some antecedents that you have not been able to see during your supervision that they're noticing, or any barriers with the intervention plan, environmental or external barriers that might be causing some interference so that you can modify as needed. And then validity and treatment integrity measure. Validity of BST can be assessed through surveys from RBTs or in an interview format during feedback phase. And then treatment integrity is collected by using the IOA during supervision of sessions with client and RBT. And then supervision also allows to ensure that data is being collected on the correct behavior topography described. So making sure that that data collection is accurate and that the data collector is understanding what or how to collect based on the written description. And these coincide with some of the BACB task list 6th edition, including task list I-5 of identify and apply empirically validated and culturally responsive performance management procedures. So going through that BST model, the modeling, practice, feedback, reinforcement, task clarification, all of that coincides with I-5 on the 6th edition task list. Apply a function-based approach to assess and improve supervisee behavior. So using function-based approaches in order to review how they are implementing the plan and to improve or assess any of barriers or extra training that is needed. And then making data-based decisions about the efficiency of supervisory practices, which is task code I-7, and that is just reviewing that data, the IOA, reviewing your procedural integrity checks and ensuring that if there is big barriers that are causing for there not to be integrity in treatment plan or integrity in the data collection, then you might need to make some modification or provide extra training and feedback in order to have that accurate data representation of your progress. Thank you.